Welcome back to the eNCA Money Desk. Now, Deborah Morgan joins us.
Hey, Dev. So I see that Aspen Pharmacare is going to start supplying its branded COVID-19 vaccine to Africa by June.
Yes, absolutely, Sally. It comes on a day when Aspen Pharmacare released solid interim results. It's now concluded, as you say, an agreement with Johnson & Johnson to package, sell and distribute COVID-19 vaccines using its own brand across Africa called Aspenovax. We've got the company's CEO, Stephen Sart, with us. Stephen, thanks very much indeed for talking to us. We'll get to that Johnson & Johnson agreement in a moment, but I see your interim profits are up 37%. That's coming from your results today. You've got some work to do on reducing that debt, though, isn't it, Stephen?
I think we've done all the work on the debt, to be candid. You know, our debt... if you extrapolate, we make nearly a billion rand a month, and we've got 19 billion of debt. So really, it's a non-issue, our debt. The earnings are very pleasing, and it's fantastic for us to be in this position. It's been a lot of hard work to get here, and a lot of it's driven through the efficiencies and the improvements in margins, and having reduced the debt is why the earnings have increased fairly substantially.
All right, so let's talk about the vaccine agreement with Johnson & Johnson. So you can now sell and distribute this COVID-19 vaccine, I mean, under your own brand in Africa. You've been calling for this for some time. How far does this go, Stephen, for vaccine accessibility on the continent now?
You know, it's interesting because when I was looking at a WHO map of the world's vaccine and vaccination rates, and the whole world's green except for Africa, which is in red and orange, which is somewhere between 20% or less. And so it's very important to get Africa vaccinated. One, because it's equitable, and two, because if you don't, when you talking about variants and variants that scare you, it's going to come from the unvaccinated, and particularly those that are immunocompromised, where Africa is sort of top on both. So I think it's critical to get people vaccinated, and we're so excited that we have an opportunity with our own branded vaccine to be a part of this.
What exactly happens in June then?
So we only concluded this last night, so yesterday afternoon. So now we have a license, we have an ability to negotiate with the multilateral organizations. Multilateral organizations are the people that buy vaccines for global markets. So it's really COVAX and the African vaccine task teams. So it's post this, we'll have discussions with them. They are all very supportive of regional manufacture because, of course, what you saw is not just developed markets taking vaccines and boosters ahead of Africa, but you even had India that was supposed to supply COVAX, limiting vaccine exports, in fact, exempting them. So where we are is that we need our own regional manufacturer, and the world realizes, including the multilateral, because the only way you get vaccines is if you make them in your continent. So where we are is we will talk to these multilaterals, and hopefully they will place orders with Aspen. If they place orders with Aspen tomorrow, for example, we're pretty hopeful that the rollout, which included a regulatory process and some technical process in the facility, we'll be able to roll that out and have vaccines in the market by June. So that's that process, we're comfortable in terms of our capabilities to roll it out. We make the same vaccine as we speak.
I mean, obviously, Aspen is beyond COVID-19 vaccines. I mean, we had Omicron, less devastating than the previous variant, Stevens. I'm wondering what medication people are buying and what's it telling us about what people's health concerns are at the moment. You're selling the stuff. What's the picture looking like?
Yeah, it's been interesting because the picture keeps swinging depending upon the waves that we face here. So when COVID was at its peak and its worst, we had a lot of general anesthetics. If I just look at a hospital scenario taking off, then when Omicron and there was less in between the waves, we have people having local anesthetics. We had almost no sales of antibiotics during the periods of heavy lockdown. It was just people weren't engaging, and then those pick up. So it's fairly volatile, the market. We are seeing quite a strong growth in our OTC business, self-medications basically. And you're right, in terms of what strategically what we're doing is that we're not sure where COVID vaccines will go. I think there's a pandemic phase, and I think there's likely to be an endemic phase, which means people who are older using it annually, comorbidities, maybe not nearly the same volumes that you might see in the short term. And what has been interesting is the capacities and capabilities we built for anesthetics primarily. We were able to pivot so quickly into vaccines, into a COVID vaccine, but also we have capabilities to make oncology products, to make narcotic products, to make insulins. And all of these are going to be critical medicines. And I'm really excited because so many people are approaching us to say, hey, Aspen, do you think that you could help us and create access along here? So I think for us, we're seeing a change in mix because of COVID, but we're also seeing new opportunities because of the capabilities demonstrated with the COVID vaccine.
All right, we're going to have to leave it there. Stephen Saad, the Aspen CEO, thanks very much indeed for talking to us. All right.